We need to remember that viruses are not standing in the queue. At one outbreak or one pandemic finish, and then the other virus will start the next pandemic or next epidemic. We should be now ready to face parallel outbreaks or parallel pandemics level disease outbreaks. So our response should be at that scale. Viruses have started this, already started, let's say, the World War III, but we as a humans are still not ready to fight them. Monkeypox or Mpox, as its name has been changed in 2022, that was first identified in some monkeys who were kept for research purposes in 1958. That was the first time we learned about a disease called monkeypox at that time. The first human case was identified in 1970 in Central Africa and countries, one of the Central African countries. From 1970 to 2022, we used to get those cases periodically every year, but very few in number one. And number two, every case was linked to the country's travel from the countries where this disease was happening. So it was not a worldwide issue. Monkeypox is caused by a virus, which are pox type of viruses. They are the same family as we had smallpox disease, which was eradicated in 1970s. The only disease which we have successfully eradicated until today. So this comes from the same family, and it's the same family from where we have the cowpox disease. So until very recent years, the older peoples, because all of us who were born before 1970s or in 1970s, early 1970s, were given smallpox vaccination. Smallpox vaccination also helped us from this monkeypox disease also. So it's a viral disease. It once a person is infected, it resolves into 2 to 4 weeks. But in rare cases, it can become deadly, and people can get killed too. It has two types, what we call clade 1 and clade 2. The outbreak which started in 2022 was different because for the first time we didn't saw travel link to African countries, and that in simpler language means that now the virus has evolved in a way that it can transmit from one person to another easily. It does not require direct contact, like direct contact in Africa or travel to Africa. So that's why for the very first time we saw this 22 outbreak in more than 70 countries. The virus was identified. Even in Pakistan in 2023, we identified, I think, 9 of those cases. That virus was spread, that outbreak was spread by a virus type of the same monkeypox virus, clade 2, which is a milder version of the monkeypox. Clade 1 or the group 1 virus, which is called a clade 1 variant, is more deadly than the type 2, which was 2022 outbreak caused. Nearly this year, more than close to 500 people have died of monkeypox disease in Africa, and especially in those countries which have not identified those cases before. So one, it is spreading more. Around 14,000 cases have been identified until today this year. So the number of cases have gone up, and the death rate due to monkeypox has gone up. That's why the WHO has declared health emergency of international concern. Now your question on what are its symptoms and how dangerous it is to the female or young kids. For most of the public or the population, it resolves itself. But pregnant women and children under 1 year at highest danger, and any other person who has severe immunocompromised disease, that could be anything. like cancers, like autoimmune diseases. In any disease in which your immune system is depressed, you are more prone to having a complicated disease and including death. The symptoms are not very specific apart from fever. Distinctive pattern is the development of rash on your body, and it could come on any part, and it goes through first there are pustules, then it evolves into the scab formation happens, and then eventually the person recovers. But important thing is that in many of those cases you will also find your lymph nodes swollen. You will find them under your arm, and this is body's immune system fighting infections. Our bodies are trying to defend ourselves from this virus, and while doing so, and this is normal phenomena in other diseases also. As I said earlier, monkeypox resolves in majority of cases, but in very few rare cases that sign symptoms stays longer than 2 to 4 weeks. So the long term, there is, at least I'm not aware of any long-term health effects of monkeypox disease once it is resolved. Even though it was discovered in 1970, a lot of research has not happened because there were very few cases every year, and they were in an isolated region in Africa. But now from the 2022, we are getting into the research, and maybe after a few years, we would be able to tell accurately about the long-term consequences of this disease. Just like COVID-19, now we are learning about long-term health effects of even a milder COVID-19 disease, which could result in a higher, let's say, cardiovascular cases or a high cardiovascular mortality over the years. What we are just learning now. So similarly, after a few years, we will have a better picture on any long-term health effects due to Mpox disease. There have been some vaccines which have been, let's say, relicensed. They were smallpox vaccines, so they were modified, and now they are the governments have recertified them as Mpox vaccines also. But there is a shortage. They are not available to what our needs are. Like in Africa, CDC have just asked for 10 million doses of vaccine to control the transmission or this outbreak at this moment. But these vaccines, many of those are not available for the children under 18 years of age, like at least one of those vaccines. But 60% of cases in Democratic Republic of Congo, where majority of cases are coming from, the patients are below 18 years of age. So for practical reasons at this moment, like country like Pakistan, we don't have access to enough vaccines. So what we should do? I think we need to strengthen our detection and then contact tracing mechanism that was developed many years ago in Pakistan, and it was pretty strong through Pakistan Field Epidemiology and Lab Training Program, or FELTP. So those field epidemiologists should be brought up to the front. They are all government employees of federal government and the provincial governments, and they know how to improve the detection processes and how to then do the contact tracing and ensuring that person is not having Mpox. And if Mpox or any outbreak, just like any outbreak, if you find a case, the strategy what we recommend is early detection. Number 2 is local control, and number 3 is to avoid the spread to a bigger area. So that approaches should be applied, but should be applied by those who have been trained in that kind of work. Every major outbreak or epidemics gives us an opportunity to improve our defense mechanisms for different infectious diseases. We had COVID-19 just recently. Now we are gearing up for this Mpox. Before that, we had dengue and all other diseases, and now Zika is also on the horizon. Instead of going disease by disease, we need to make sure we develop our disease, what we call is a health intelligence system, which is more than disease surveillance system. So disease surveillance system is just reporting cases like how many people died, how many people are sick. But health intelligence system go beyond that and try to identify risk much more earlier and control them much more quicker, so we can prevent the spread. Because once an infectious disease spreads from that local area, it becomes very difficult day by day to control it. So our biggest chance is always when the disease is very localized. So we need to strengthen our those capacities, and they does not confine to one disease or other disease. We should be working on all infectious diseases or a strong health intelligence system, which will help us or to protect our own population in Pakistan.